I'm Brittany Olinger.
I'm Amanda Rogers. I'm Brittany Silva.
And we're discussing the Patient Protection Affordable Care Act.
The Patient Protection and Affordable Care Act is the new healthcare law that will be majorly affecting Americans in the coming year. The principle behind this mandate is the requirement of most United States residents to take responsibility and contribute to their own health insurance costs. Throughout this presentation, we'll be covering the history, statistics, business practices, impacts on society, and ethical concerns.
Out of all the affluent countries in the world, the United States is the last to pass a universal health care law. The Patient Protection and Affordable Care Act is a newly implemented program that has been attempted in the past but was unsuccessful as few Americans supported it. While in office, President William Clinton tried to pass a universal health care law, but was unsuccessful. As the candidates were campaigning for the 2008 presidential election, health care became a huge campaigning topic for them. In the election of 2008, Barack Obama was elected president, and within 2 years, on March 23, 2010, President Barack Obama signed the Patient Protection and Affordable Care Act, otherwise known as the Ppaca. The Ppaca is also known as Healthcare Reform or Obamacare. In 2012, more than 47 million Americans were uninsured. The majority of the uninsured are from low-income working families. Of the 47 million, 61% stated they were uninsured because they were unemployed or they could not afford it. Once the Ppaca is implemented, 14 million people will gain health insurance. In 2012, 198.8 million residents had private health insurance, and 101.5 million residents were covered by government health programs. Many employers are starting to cut their workers to part-time, which is less than 30 hours, because they will not then be required to offer health insurance benefits or pay the penalty. As many as 2.3 million Americans may have their hours cut. The city of Cedar Falls cut many of their workers to 29 hours per week. The Cedar Falls Administrative Services Director, Richard McAllister, said, "If all 59 employees whose hours will be cut were to take advantage of health insurance, it would cost the city $855,000 per year. If we were to leave their hours the same, we would be potentially laying off 25 to 30 employees. It's difficult for employers to decide to either just cut hours of employees or lay off or get rid of their positions to save the company money."
There are many new rules from Ppaca that has caused human resource changes in small and big businesses. It is important for companies to understand the policies of the Patient Protection and Affordable Care Act in order to supply the proper benefits to their employees and to comply with the rules and orders from the government according to Ppaca. An important benefit for small and big businesses provided by the Ppaca is that employers will not be able to choose to provide health insurance without an expense. In the past, employers were not forced to provide coverage which allowed them to cut costs, making the company more profitable. Now, however, this healthcare requirement will be an asset to companies. Wichosek states that many employers are drawn to healthcare benefits, so the more an employer can offer, the longer an employee is going to stay with that company. While the benefits may cost the company more in a short-term aspect, expenses will be saved in the long term, leading to more profitability. Costs to advertise jobs availability, hiring, and training costs will also be saved. Torso Solutions is a premier employer in Madison, Wisconsin because they offer competitive wages and attractive benefits. To provide these benefits, Torso Solutions invests a significant portion of the premiums so their employees can pay as little as possible. A human resource representative from Torso Solutions explains that with the new Affordable Care Act, the human resource representative from Torso Solutions explains the short-term and long-term complications of the Patient Protection and Affordable Care Act. The representative explains that employers will have to consider the cost to offer insurance compared to paying the penalty. In some cases, the expense of the fine may be cheaper than offering adequate health care for employees. Torso will also have to have a discussion in regards to project employees. They will have to decide if it is beneficial to offer those employees health care for the time they are employed with Torso, or if paying the fines would be more beneficial. Furthermore, in future years, there are many businesses that could consider opting out of providing healthcare because the government is doing it. Businesses are categorized into small, medium, or large companies. Small businesses have 25 or fewer full-time employees but the average annual wages per employees are less than $50,000. Medium and small businesses have 26 to 49 employees, and medium-sized businesses have 50 to 200 employees. Large businesses have more than 200 employees. Through the 2010 healthcare legislation, a play or pay environment is created. What this means is businesses are expected to participate in the new healthcare law by offering adequate coverage, or they will pay a fine to the government. To lower costs of the new healthcare coverage, small employers may be eligible for business tax credits. This is an incentive for small businesses to provide healthcare insurance. Also, in order to reduce the cost of paying, small employers who pay at least half of its employees' premium amounts are able to receive tax credits to offset tax on the income earned by small businesses. If employers choose not to pay, which entails not providing health insurance, the legislation provides an alternative state exchange. State exchange entails that each state must create an exchange through which numerous health insurers make coverage available in a pool that is set up and administered by the state. State exchanges make health insurance available to people who are without coverage or to those who do not have the means to pay for coverage. Low-income employees may be entitled to receive a free choice voucher from their employers. These vouchers may be used to pay for part or all of the state exchange. Also, low-income employees may be authorized for tax credits or premium subsidies that are usable for state exchange. The changes in the United States healthcare system allows for many opportunities for agents and brokers to partner with their clients as strategic advisors. Brokers and agents are usually in a sales role. In this new advising role, agents and brokers can offer understanding and opportunities around the Ppaca changes that have an impact on employers and employees. These broker and agents are able to gain revenue in areas that had not been utilized in the past to benefit their clients. The services that agents and brokers should consider to enrich their practices and to support their clients through the Ppaca changes are to offer optional benefits, steering through ACA, and to ensure financial protection. Their goal is to bring understanding to employers about options offered through the Ppaca. They must connect directly with an employer's legal team and human resources department to confirm that they have the decision means in place to support company insurance decisions. The effect on sole proprietors and others with no employees will be much like the effect on individuals. The individual mandate requires all U.S. citizens and legal residents to acquire health coverage or pay a penalty. The individual mandate begins in 2014. If costs no more than 8% of income, non-compliance penalty of the greater of 95% or 1% of taxable income in 2014, increasing to the greater of $695 or 2.5% of taxable income in 2016. The principle behind this mandate is that everyone should contribute towards their own health insurance costs, rather than just show up in the emergency room and giving society the bill for the cost. Many benefits are seen with the Ppaca in regards to small and big businesses. Employers are able to receive tax credits to offset the cost of insurance. However, there are still many disadvantages to businesses. As the human resource representative stated, businesses will have to decide whether it is financially beneficial to offer healthcare packages or to pay the penalty and allow individuals to seek their own insurance.
An increasing problem in the United States is ill individuals lacking health care coverage. People lack health care because costs have skyrocketed in the last few years. The Ppaca will change this problem. Individuals and families who can't afford insurance will be added to Medicaid, which is a governmentally funded program for low-income or needy families. With this program, enrollees do not pay monthly premiums. Almost a third of the uninsured in America will be added to Medicaid. This option will also be available for young adults. However, young adults up to the age of 26 have the option to be on a parent's plan. In the past, students and young adults were only able to be on their parents' plan until the age of 18. The new law will be helpful for college students who may still be pursuing their degrees past the age of 23. Another pro of the Ppaca is the elimination of pre-existing conditions. These conditions have been labeled as expensive to insurance companies and are grounds for the denial of coverage. Now, however, insurance companies are unable to deny coverage due to pre-existing conditions, allowing more Americans to receive insurance. Even though there are many benefits, there are just as many disadvantages. The most controversial part of the new law is the fines associated with noncompliance. Any person who is uninsured after March 31st of 2014 will be fined an amount according to their income. These fines will be 1% of income, or $95 per adult, and will rise to the higher of 2.5%, or $695 per adult, in years to come. Even though an individual has insurance, it doesn't mean he or she is fine-free. Those who do not have adequate coverage, a fine will also be issued. The Americans that do have adequate coverage that meets 10 criteria, which are ambulatory services, emergency services, hospitalization, maternity and newborn care, mental and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative care and chronic disease management, and pediatric services, including oral and vision care, can keep their plans. These plans are grandfathered in if created before March 23, 2010. This may sound like a benefit, but is actually a disadvantage. While new plans offer preventative care for free, grandfathered plans do not. Grandfathered plans also don't allow the insured to choose their own doctors. Varying rules for each group of Americans is also seen in cost. Health insurance providers will now charge each person a different price. More unhealthy adults will be charged a higher price, while healthier adults will have a lower premium. Even though coverage is available, Americans may still be unable to afford the cost. Supporters of the Ppaca claim that costs will decrease over time as the system stabilizes itself. However, the first few years will show higher premiums than with private providers. Grandfathered plans will also experience an increase in premiums. Americans will experience these raises due to more unhealthy individuals receiving coverage who may have been denied in the past because of pre-existing. With the implementation of the Ppaca comes the health insurance marketplace. This program allows Americans to comparison shop as they would a vehicle, and it takes the uncertainty out of choosing a plan that is right for the individual. He or she can specify a price range and coverage he or she wants, and the program will generate options that are tailored to that person. Americans who do not take advantage of this new marketplace have until March 31st, 2014 to sign up for a plan. If someone misses the deadline, he or she is unable to sign up for coverage unless he or she has a qualifying life event. These events are moving to a new state, certain changes in income, and changes in family size. These changes may not happen often or at all for some individuals. Options for Americans who do not have a qualifying life event are still undecided. Americans who have children may choose to insure their children under the option called Children's Health Insurance Program, also known as CHIP. This program covers many of the same aspects as the adult plans, with preventative care as a highlight. In the next year, the number of insured Americans will rise by millions, leading to a high demand of doctors. In the years that it takes to fill this demand, quality of care will decrease. Existing physicians will have to increase the number of patients they see each day, which leads to lower quality for each patient. In this case, doctors will have to choose whether to provide basic care to more patients or turn away individuals to offer existing patients quality care. Doctors are also required to adopt compliance plans. This means doctors have to adhere to new laws enacted by the Ppaca. However, there have been no reasons for implementing other than the doctors should. Doctors will also have to adopt compliance plans. This means doctors have to adhere to new laws enacted by the Ppaca. Until information is shared why doctors need to implement these plans, this implementation could be halted. For individuals, implementation has been halted. Americans should have been able to enroll in insurance plans starting in October of this year. During this month, the websites for researching and enrolling had crashed. Because of this problem, no one could register for the Ppaca, which could discourage the population from ever registering. Some Americans had also questioned if the Ppaca was constitutional in regards to the fines. This question went to the Supreme Court, where the Ppaca was ruled constitutional. This ruling authorized fines due to be taken from income tax refunds. If the individual does not receive a refund, he or she is exempt from the fine. This exclusion of certain people has been seen as unfair by many people. When first discussed, the Ppaca was going to be implemented by all Americans and organizations. Now, however, President Obama has postponed implementation of elected officials in Washington, D.C. The reason for this is they're losing many benefits and having to pay for their own coverage. The popular question now is, if it's not good enough for Washington, to change Americans' attitudes, Forbes suggests to make health insurance pro-free market. This means that insurance companies would compete to offer the best price and meet the needs of the customer. Programs funded by the government would not be eliminated, but just decreased. For example, Medicaid would still be offered for low-income families and the needy. An option like this would give the Americans the choice to obtain insurance or to go without.
Universal health care is a controversial achievement of the Obama administration. All Americans will now have access to affordable health care provided by the government. Access to this health care will have a dramatic impact on the individuals. Approximately 14 million Americans are expected to be newly insured, while 129 million will be able to keep their coverage. No longer will businesses be able to choose whether or not to provide healthcare coverage without a penalty. The PPACA requires companies to offer adequate coverage to all employees. To offset the cost of insurance, the government is providing tax credits to companies who supply a percentage of the cost for their employees. For some companies, paying the fine for each employee would be cheaper than paying for the employee's insurance plans. Employees who do not receive health insurance through their employers are responsible for finding their own coverage, whether it be through government plans or Medicaid if they qualified. Americans who currently have health insurance are able to keep their plans as long as they are considered adequate, which means they were in place before March 23, 2010, and meet the 10 requirements provided by the government. If they do not have an adequate health plan, they have to sign up for a different health plan or face a penalty or fine for being inadequately insured. Slightly higher premiums and fines or penalties will be issued to those individuals who are uninsured. There is great uncertainty to the effects of this law, which will not be seen until the implementation starts in 2014. This uncertainty has been enhanced lately due to the crash of government websites. The Americans who want to research plan options or enroll early will have to postpone their search or enrollment until the websites are fully functional. The functionality of the websites is not an easy fix. This problem is expected to last for many weeks, if not months. This uncertainty has been enhanced lately due to the crash of government websites. The Americans who want to research plan options or enroll early will have to postpone their search or enrollment until the websites are fully functional. The functionality of the websites is not an easy fix. This problem is expected to last for many weeks, if not months. Inability to enroll may have a negative effect on the number of people who do sign up, meaning those who cannot sign up may seek other options. Even though there are technical problems with the sign up, the deadline is permanent.